Okay, so hello everyone. Welcome to this amazing session where we have with us Dr. Anil. I'll just introduce Dr. Anil. Dr. Anil Parekh. He's a dedicated practitioner specializing in homeopathy, weight loss, and nutrition. He has authored two insightful books, namely Food Label Decoded and This or That. He's got over 10 years of experience and has successfully guided more than 1,000 patients like us to achieve their ideal weight and improve their overall well-being. So today he's here to discuss an important topic, which is the benefits of workplace wellness and how movement and activity are very important for employees. So a very niche topic. I welcome Dr. Anil for this amazing session. Dr. Anil, the floor is all yours.
Yes. Hello. I hope I am clearly audible. Okay. So to begin with the session, before I begin with the exercise and activity and all, I would like to ask one simple question. So let's say whether you are running late for your work, you're out on a vacation, or you woke up late on a weekend. Will it change whether you are going to brush your teeth or no? Any answers? I hope not. And most of us would brush no matter what the scenario or the condition is. Why? Why would you brush your teeth? Again, for the obvious reasons, because we know what is going to happen if you don't. Now, the same thing applies when it comes to exercise. We all know the benefits of exercise. But what we don't know, or most of us don't pay attention to, is what will happen inside your body if you are not exercising, or let's say if you're not physically active. Now, what I'm talking about here is a very simple thing called as metabolism. I am sure most of you have heard about this. You may have seen people telling someone has a low metabolism or a slow metabolism, someone has a high metabolism, someone can eat anything and everything and still doesn't gain weight because he has a high metabolic rate. Now, all these things come down to a simple word called as metabolism. Now, what is metabolism in a layman term? It is something that your body, the amount of energy or the calories that your body burns to keep you alive, to keep you function, to carry on your day-to-day activities. Now, why I am stressing on this word metabolism? Because your three major lifestyle disorders, when we talk about, that is your diabetes, your cholesterol, your blood pressure, they are directly linked to how much you weigh. In other words, what is your weight or how much fat you carry. Now, your weight has a direct relation to your metabolism. So, someone with a slower or a sluggish metabolism would tend to gain weight faster as compared to someone who has a robust or a fast metabolic rate. Now, this is where the changes happen. Now, when we talk about metabolism, now this metabolism is made out of four different things. Your body composition, now this is the amount of fat and the muscle that you carry, the food that you eat, the physical activity, this is your typical exercise that you do, and the last part is the NEAT. Now, what I'm going to talk or stress today is on the NEAT. This is where I will focus. Now, NEAT is non-exercise activity thermogenesis. And what does this mean is everything that you do outside a typical definition of exercise. Like going to a gym would be a typical definition of exercise. So whatever you do outside that, it could be maybe taking a walk while talking to someone, standing for some time, fidgeting, maybe playing, maybe doing any other activity that is not defined as a traditional exercise. Now, why this is important is because this holds around 10% of your overall metabolism. So a person with a better NEAT will have a boost towards his metabolism. Now, better the metabolism, better would be the weight management. Better the weight management, less would be the chances of developing three major lifestyle disorders, that is your diabetes, cholesterol, and the blood pressure. The less are your chances, less would be the mortality rate. Hence, the importance of NEAT. Now, what does research or statistics have to say is, now research has linked sitting for long periods by Long periods, I mean anything which is beyond 8 hours. So research has linked sitting for long periods with incidence of high blood pressure, high sugar levels, obesity, high cholesterol levels. Research has also linked sitting for 8 or more hours with no physical activity. So a person with habit of sitting for 8 or more hours with no physical activity had a risk of dying similar to that of someone who's a smoker. The positive side of being active, regular physical activity is also associated with increased life expectancy for up to 7 years. So far, does anyone have any question? Okay. So now moving on ahead with the topic, I would like to give you 5 easy exercise that you can do at your workplace. Now, these are something that you can easily do them right at your desk. You don't have to go anywhere, whether you're in an office in an offline mode or whether you're working from home. All you have to do is these simple exercises that you can do right at your desk. First one is the neck rotation. Now, because of the posture that we take, the seated, your neck takes a huge toll. Now, simple neck rotations in all the direction, left to right, front and back, and side to side, will help you release all the tension that is around the neck. People who are into desk job frequently complain of upper back pain and neck related pain. They complain of tingling numbness in their hands. Most of the time, the problem lies around your neck. The second exercise is your shoulder and back stretch. This is again a very simple exercise. All you have to do is just put your hand behind your head and stretch your hand behind. Now, in a desk job position, the shoulders are turned forward, like the way we sit. So all you have to do is do the opposite. Put your hand behind your head and then stretch your elbows backward. The next is wrist rotation. Again, the position that we take while typing gives a lot of stress around the wrist area, and wrist pain being a very common location for people who work into work into desk job or have a lot of typing to do. So a simple neck wrist rotation, like all you have to do is just lift your hand, make them straight, and do clockwise, anti-clockwise circle, down and up. This is a simple exercise that you can do right at your desk. Next is a high knee or a figure of four stretch. Now, if you're let's say if you're working from home, all you have to do is just stand and pull your knee close to your chest. Hold it for a few seconds and then repeat it the same thing on the other side. Same thing applies, or let's say if you're working offline, all you have to do is, if you're seated, lift your leg and put your ankle on the opposite thigh. Hold it for a couple of seconds and then repeat the same thing on the other side. This you can do for as many times as you want throughout the day. The last is simple standing at your desk for 5 minutes after every 30 minutes of sitting. Any questions so far? So moving on, these are certain tips that you can use while to stay active at your workplace. First being stand or move whenever it is possible, especially while talking on phone. Walk to a water station rather than keeping bottle at your desk. This will ensure that there is some movement. Walk or stand during your tea or coffee break rather than sitting. If your workplace allows, conduct your team meetings, discussion, conference, standing rather than sitting. Anything? Hello? Avinash, Ishan?
Yeah, Dr. I mean, it seems fine.
Yeah.
You can just go ahead with the presentation.
No. The presentation is over. I'm waiting for questions.
Okay, yeah. So we have one questions from the audience.
Yes.
So one of the audience asks if so any other suggestions for how do they maintain their health during the pregnancy when they come to office? So is there any other such suggestions or something of that sort?
One, see, this will also depend on which month the female is. Okay, one is taking a good back support. So putting a pillow behind her back. One. Second is she should be changing her position every now and then. So the guideline which I shared, like 5 minutes of standing after every 30 minutes of sitting, the same applies to her as well. She has to move. Another thing is, see, all the guidelines, all the tips that have been shared, like going to a water station, taking a tea break, the same thing will apply to her as well. And the one which is over here, especially standing for 5 minutes, this she has to do. She has to make sure that she is moving around and standing every now and then. Anything else? Avinash?
So Anil, we have
Yeah.
one more question.
Yes.
So one of the user asks, so any other generic suggestions regarding the health? So how does the nutritionist like kind of how does any food habits or these things, how do they related to exercise? So is there any complementary things which one has to follow or something of that sort?
As in, I did not get. Like, can you be a little more specific?
So regarding exercise, so other than the workplace exercise, is there any particular nutritional food which has to be complemented to the exercise or something of that sort?
Okay. The protein. Typically, Indian style of eating, whether you are a vegetarian or a non-vegetarian, all of us somewhere lack in our day-to-day protein count. Now, when I say protein, I don't mean that you have to go and buy whey protein supplement, but making sure that most of your meals that you take have some protein element. Now, this can come, if you're a non-vegetarian, this can come from chicken, egg, fish. If you're a vegetarian, this can come from paneer, can be milk, curd, moong, matki, rajma, soya. So ensuring that every meal that you take, especially the three major meals like your breakfast, lunch, and dinner, has some source of protein in them. So this would complement your workouts. If you've been exercising on a regular basis, your body will need increased protein requirement. So if you're adding some amount of protein throughout the day, it will complement your exercise. Anything else?
So Dr. Anil, any particular exercises, like any important exercises for every individual which needs to be followed? So can you just specify any, can you highlight anything which
If I
can
have to give one exercise that everyone should do, irrespective of their age and gender, is trying to squat. So if you have no joint issues, no knee complaints, if medically you are allowed to do so, then I would suggest everyone to try to do a Indian traditional way of squatting. Try and go as deep as you can. It will help you open up your entire pelvic area, which gets compromised in our day-to-day sitting habits, the kind of work we do. So most people, they complain of stiffness around the hip area. So if you can do a squat, a good squat, that will help you open up that area. And the second thing that someone should do is a plank hold. Now, again, the lower back is a very common area of complaint, again, because of our sitting job or the way we sit. So if you can hold a plank position, it will strengthen your core, which will reflect in your relief from your back pain. Anything else?
Thanks a lot, Anil. Thanks a lot for your time. I guess audience must have learned something from this session. Uh, thank you, everyone. Thanks for